assessment of the skin. So we will start with the theoretical part of assessment. We will take the assessment of the skin, mostly the skin and nails are coming together. So mostly we will concentrate on the head and face, and also the body. So we will see what kind of thing that we are going to assess when we are examining or assessing a client. So our objective, we have to use the correct technique in assessment of skin, hair, and nails. And we have to identify the normal finding of skin, hair, and nails. Use the correct technique in the assessment of head, face, and neck. And identify the normal finding in the head and face and the neck. Then clearly comment the verbally communicated the objective and the data which we find. When we assess the skin, you know that the skin, it is the largest organ in our body. And sometimes, mostly, it reflects many kind of health problems that might be there within our client. So it's important to understand how we can differentiate between normal skin and if there is any abnormality within the skin. Yes, mostly, do we have the same color?
No.
We didn't have the same color. Do we have also in our body parts, do we have the same shape also? There are some slight difference. So we have also to understand, differentiate between the difference between people and the abnormalities, if abnormalities is present there. So, in assessment of the skin, also we will assess the body circulation. We can identify how we can identify the circulation from the skin. So the color of the skin, it will reflect also the circulation, the blood and the blood circulation in our body. So usually if the circulation is well and good, how we can understand it from the skin, from the looking at the patient face?
Color.
What kind of color that we
Blue.
sorry?
It's not pale.
So it is not pale, which means it is normal. So it is not pale. It's usually shiny. It is toward pink also. So especially when we are looking at the lips and when we are looking at the nails. So we can understand from that the blood saturation and all those things. Also from the skin, we can understand the nutritional status of the client. The nutrition itself, we can understand it from the looking at the skin. So we can, if the skin color will be changed, the texture will be changed in case of nutritional disease or deficiency. Also some signs and symptoms of diseases. It might appear there, and changes of the color mostly is there. In case of liver diseases, where you might find that the color of the skin, it will be going toward, not red, yellow.
Yes.
So it went due to the accumulation of bilirubin in the skin. Integumentary system or skin problems also, there are many problems that might affect the skin itself. So we can identify problems which affect the skin and problems which is from other system and it is appearing on the skin. There are special considerations that we make a difference between people. So the consideration that make a difference, there is difference according to age and also sex and gender of the individual. So according to the age, also the expectation of the skin and how the skin will look like, it is different. Because the amount of water, also the amount of subcutaneous tissues, it will be affected by the gender and also by the age. In old age, we will expect some changes also due to the old age. Genetic, also race, it will give a different color of skin also. The exposure to sunlight, it will change the pigmentation, it will make the skin slightly dark when we are exposed to sunlight. The climate also, it will affect if it is cold or hot climate, it will affect our skin and it will lead to changes. Pollution also, it will be affecting our skin if there is any pollution within the area. Exercise that we are doing also, when we are doing exercise, there are changes that will appear in the skin. While you are doing exercise, what kind of thing that you will observe it in your skin?
Redness.
So flushed face or flushing of the skin and sweating will be there. Nutrition also, and the type of nutrition, sleeping pattern. If there's someone is not sleeping for a period of time, what you will expect? You will feel that there are some blackness, little changes around his eyes. Emotional also, well-being. The emotion itself, if you are feeling shy, does that be reflected in your face or not?
Yes.
Yes. If you are anxious, does it also affected or reflected by your skin and also the face? You observe it? Yes. Also, beauty and routine care. Those who are taking care of their skin, also it will affect their skin and the healthy and shyness of their skin. Those who are not neglecting their skin, also they might have some dryness, they might have some cracking, also the cleanliness. All of those, it will affect the skin integrity and what is expectation. So, from the variable in the emotion, we said that if you are feeling shy, sometimes you have flushed face will be there. If you are anxious, the color of the face also might be darkened due to the anxiety. Fear and anger, peripheral vasodilation will be there. Your flushed face will be there. Embarrassment also, flushing face is there. It can be also, in this case, it might be misinterpreted. Interpretation might be not in a correct way. So we might, as a health worker, if we are not understanding that the patient condition and he is feeling anger or embarrassed, we might think of some kind of disease, because erythema also it might give the same signs. Environmental factor also, it will give a flushed face. We might think that the patient is having fever. Or hot room, it will lead to vasodilation. Also, this will lead to false erythema. Chilly or conditioned room, vasoconstriction will lead. That also we might be conflicted with the coldness of the skin, that there is something related to the maintenance of body temperature. Cigarette smoker, vasoconstriction, it will lead to valve discoloration, and by the way, it will lead to abnormalities later. Physical problems or physical activities, prolonged elevation. If we are going to high altitudes, it will affect the level of oxygenation. So also it will give a pallor and coldness. Dependent position. Depending on position, also sometime when we are staying for a long time in the same position, if we are sitting or if we are traveling by plane for a long time, if it took 7 hours, sometime we will find that we are having swelling in our legs. Even if we are, if our healthy condition is in a good condition. So immobilization for a prolonged time, also it will slow the circulation and it will give some change. So there are different things that will affect our skin, and it might be just a physiological changes, temporary physiological changes, or it might be a kind of a disease. When we are preparing for physical assessment, and any physical assessment, so in preparing for examination of the skin, we have to prepare first our equipment. What are the equipment that we are in need for? So what kind of thing that we will examine? What are the 4 techniques of examination that we are using?
Physical examination.
Treatment.
Before palpation, inspection. So we are using our eyes for inspection, and sometimes we might use some kind of lenses in case of some pathological changes to see it properly. So inspection, we start with the inspection, then palpation, then auscultation and percussion. So those are the 4 concepts of that we use. So if we want to use do auscultation, so stethoscope should be there, and we have to have cotton swab in order to clean our stethoscope. We have to keep it also warm. Otherwise, we might need gloves also when we are going to do palpation. So those are the main thing that we have to do it, to have it in examination of the skin. We might need swab culture if there is some lesion. So in this case, we might need a swab for sterile swab for doing culture. So the equipment, it depends upon the condition and what we are going to examine at that time. Then also we have to wash our hand, prepare ourselves, wash our hand before doing any procedure. Then for any procedure we have to say, introduce ourselves to the patient. Hello, I am, my name is, and I am your physician today, or I am your nurse today. I want to do this kind of assessment or this kind of procedure. Can I do it? Take a permission. Being sure of the patient identity, asking about his name, and also
ID band.
see the ID band. Is he the one that we want to do the assessment for him? Then we will start the actual assessment for our patient. Position the patient in a proper position, and assessment of the skin. We can put the patient in a semi-sitting position or sitting position. It depends upon the site that are we going to assess the whole body skin, or it depends upon is it a routine examination or the patient is complaining from something. So if he is having complaining, having some complaint, in this case, it depends, a focus assessment would be. So the proper position is either upright position or sitting position or semi-father position. It depends on that. Skin assessment of, we start with inspection and palpation. So inspection, which is visualization and smelling, keeping the mind that the amount of pigment of the skin, account of the intensity of the color, as well as the tone. So we have to keep in our mind that also people are having different variety of the skin color. So the skin color, it has some variation. It is from albino, which is completely white, to dark skin. It depends upon the race, it depends upon the genetic factor, and it depends upon also the level of health. Normal skin, so in the normal skin, the color, as we said, there are variation of the color. So when we are checking the patient skin, first we will look at the color, and is there any variation from the normal color of that race? So is there any difference in the color? The pigmentation also, if there is any pigmentation, because some people are having some pigmentation. Well, it is relation to
ايش pigmentation مثلا؟
تصبغات. So different.
البقع؟
نعم.
لذلك معناها
هذاك ما خلاص بقع.
بهاق.
ايوه.
بهاق, it is different. It is loss of the pigments there. So loss of color. So unusual prominent discoloration is there. We can observe it. So what we are looking for the general skin color of the client. Then in that, the important thing is to look for also differentiate between normal and abnormality, regardless to the color of the patient. If he is white or if he is going toward dark skin, is there any cyanosis or not? Cyanosis, which is bluish discoloration, which mean that
Skin abnormal.
it is related to what? This one. It's related either to respiratory system or cardiovascular diseases. So both of them, they are affecting the cyanosis will be there. We can see it regardless to the color of the patient skin. We can see it on the palm of the hand. We can see it on the nails. We can see it in the lips. So those areas, because usually it is pink, regardless to the general color, differences in the color of the person. This is it normal skin, this one? So
Yes.
it's really normal. For this one, is it normal? No, it is not. It's bluish discoloration. Here,
not normal.
seems some redness is there, also some buffness is there, some swelling is there in the face. So those variation, it is normal. There are different. Depend upon the, so it might be pink. You might not. Actually, in the patient you can see it with the other part of the body. So here, differentiate between this and this. Here,
المسترك الصفراء.
yes. So this is jaundice. It means that either liver disease or hemolytic disease. There are many diseases that will give raise in the bilirubin and it will appear in the skin color. So the skin color, and it will be apparent mostly first on the eyes, on the sclera. So pallor, jaundice. So here
نمش.
there is some pigmentation, which is some loss of pigment here and more pigmentation. It might be due to exposure to the sunlight. It might be sensitivity to the sunlight. It might be other diseases. So color variation and lesion might be normal. Here, see what's this? It is not considered as a cancer. It is considered as moles and labels. شو بسموها انتم شامات او فهاي اللي الشامة او changes. It is considered, by the way, from the benign tumors. It is benign growth. يعني ورم حميد يعني ما
يعني
نفس التشوز بس ما لها تأثير. For those navies and moles, if it is becoming big in size within a short period of time, and also the texture of it is changed, it means that it might be changed to cancer. So we have also to observe them if they are. What's this?
أيوة وحمة.
وحمة أو birthmark. we call it. So it is a birthmark. It's not necessary to disappear. Some they will have it for the whole life. Yeah, so mostly they will have it, but it might be some slight difference between at birth and when he is getting born. So there might be some changes. See here,
حساسية.
very rough skin is there. It might be. This is under lens, so it is small. And here, see, there are some skin lesion. So some abnormalities, some skin lesion is there, abnormal skin lesions. Here, a wide range of rashes. So rashes are there. It might be due to infectious disease like measles, like.
ايش هذا المستعد؟
So it is rashes. we call it. rashes يعني الحبوب الحمراء اللي بتصير طفح جلدي بسموه طفح جلدي. So erythema here also from kind of inflammatory process. Erythema.
الأكزيما هي
Eczema, there are a different variety of changes. So we will observe if there is any cut. There might be wounds, there might be scratches. Also in the skin, we have to assist them. So we will assess the skin integrity, check also the pressure area bond, especially if the client is immobile, if he is having difficulty in movement. So the pressure area, it will lead later if we are not moving the client, if we are not taking care properly for the client, it will lead to bed sore. So we have to look at the pressure point according to the position that the patient is having. Those who are lying, when he is lying on his back, the occipital part it might be affected, and the shoulder over the bone prominent area, the buttocks, the calf muscle, so all of those, and the heels. So it depends upon the position. If he is chair bind, if he is not, we usually. If he is chair bind, if he is using the wheelchair and he cannot move without the wheelchair, also those are the elbow might be affected, the shoulder, the spinal processes, the heels also, the ischial process, in side leg position, the ankle here, the knee, the hip, the shoulder also, they are pressure points. So we have to observe if there is any changes, any sign that might lead to pressure sore. Pressure sore, you will take it in fundamental in detail, and the degree of pressure sore. طبعا it will start with redness and change in the color of the skin. Then it might end with deep wound at that area. So in order to avoid it, we have to evaluate it. You might see those kind of changes due to what?
دقة.
Either due to trauma, or it might be due to here which it might be due to intravenous, either withdrawing blood or giving IV fluid. So it means that blood is there under the skin. So this color, it means that there is a blood under escaping from the blood vessels, and it is under the skin. Internal bleeding, usually when we are saying internal bleeding, we are saying inside the cavity. So this is, yes, it is, but it is bleeding under the skin because we can see it here. Skin assessment, palpation. When we are palpating the skin, we are palpating the skin texture. And skin texture also, it has to be smooth, the skin. So when we are feeling the skin, it has to be smooth. And also soft, flexible. When we catch the skin like this, it has to return back immediately. If it is normal skin. So when we are pressing also, it will return back and also refilling, and the color also, it will return back within a short period, seconds.
ايش الفرق لو بين
نعم.
الفرق يوم تسحبي؟
يمسح بيه يرجع بالمرة.
شو اللي يرجع؟
يعني في النص الدش يرجع بالمرة.
يعني الآن هل في فرق هون مثلا لو جيت هون سكين هون سبب العمر بيختلف على اليد وبيختلف من واحد لواحد. يعني شوف تحت تأخر get a time. If I am dehydrated also, it will take more time. If hydration is well, it will return back easy. So also you will see the vein, the congestion of the vein. In younger, you can see the vein mostly there. It depends upon also. In females, the veins are not apparent mostly because of the subcutaneous fat. It will alter that. In old age, yes, it is apparent, but it is difficult to deal with it. So it is smooth, even, and soft and flexible. So the thickness, normally the skin is thin and depend upon the side of the skin. We might have rough skin, rough يعني خشن. thickness of the skin depend upon also. يعني in the palm of the hand, the skin is more thicker than in the dorsal of the hand. In the palm of the foot also, it is more thick because we are using it for walking in. So it depends upon that. See here, this is a sign of old age. And see here the difference. So it depends upon the age, it depends upon many things in our body. When we palpate the skin, we are also palpating, we are seeing first the hotness or coldness. We see check the temperature, we can check the temperature also with the light palpation. We check the texture. So moisture also. So skin surface vary also from some people they are having moist skin, some of the people they are having dry skin. So there are different variety of skin also in the recent activity. If we are doing activity sometime after the activity also our skin will be moist because of sweating will be coming out. Because of the dilatation also the color of the skin it will become red because of the dilatation of blood vessels. And that will increase the warmness and also the moisture of the skin. Temperature, the temperature also it is warm because our skin temperature it is around, it is less than the 37, but it is around 36 degrees centigrade above the skin temperature. If it is high, it means that the patient is having fever. Mobility and turgor of the skin. So the skin, it is elastic. As we said, the elasticity, it means that when we pinch the skin, it has to return back immediately after we put it off. So this is the elasticity of the skin. It will return immediately. Chest of elderly or adult, hand and infant, there are a difference between them. So in an old man, it will take a long time because it will not return immediately because of the subcutaneous tissue and because sometimes of the dehydration. See here, there is edema. So when we are palpating, when we are pressing there, see, it might not return back immediately because of when we are pressing the fluid, so the fluid it will move the excess fluid which is there in the tissue, it will move to the other tissues and it will need more time until it return back. So we call that it is pitting edema. So edema is there. Hair and scalp inspection, when we inspect the hair, we have the hair distribution. There are different distribution according to the age, according to the race. For somebody who is like me, you will not have a problem with that because you will not find any hair. So it is easy to observe the skin. And also there is no space, no space for infestation of lice or so. But for those who are having thick hair, there might be, you might find some thing inside. You might find lice or within the hair. So you have to wear gloves, check inside the hair, see the hair distribution. Here there might be, it is alopecia. See it is no. This is different.
الصلع أنا كامل.
صلاح. So that's, it is related, balding, it is related to the age, it's related to the race, it's related to heredity. But here it is infection. It is related to disease. It might be due to fungal infection. There are many variety of diseases that may not affect the skin and lead to loss of hair. And here lice, camel. There might be lice might be there. You might find lice because of that when you are dealing with those patients. And lice, by the way, it might be there in case of crowded community, lack of cleanliness, and it is infectious. You might be cleaning yourself properly, but you are living with someone who is having lice, so you might get the lice with you. So the condition, cleanliness and grooming of color, scalp and contour of the skin, inspection of the nails. Also, we have to inspect the condition, cleanliness and grooming of the nail. Some of the nails might be brittling. The color, what is the color of the nail usually?
Pink.
It is pink in color. When we are pressing also, capillary refilling will be there immediately. The color, it has to return back to normal immediately. Shape also, the shape, it is, there is an angle, and if there is different, sometimes like spoon shape, you find that spoon shape is there. To me, it's reflect a heart disease.
ليش مستر يقلع الظفر؟
It might reflect also. This is another. It might reflect the nutritional status. If there is brittling nails, تحس إنه أحيانا الأظافر بتقصفوا. They might have cracks or change in color. This is might be due to nutritional status. Black discoloration might be due to hitting by something, so bleeding might be under the skin. What's your question? حاجة.
برأيي خلاص جاوبني هنا.
جاوبتك؟
لا مستر، أنا عندي سؤال مستر. هذا ايش يعني احيانا يتعوروا في ظفرهم يقلعوا كامل الظفر
وبعدين ينبت متعود. ايش السبب يعني ما ينبت نفسه كذا؟
It depends upon the case. So and it depends upon the injury. There are also different way of dealing with it. Some they are not removing it. They will treat the wound which is there, even if it is if the nail is cut from the and wound is there underneath it. They will clean the wound sometimes, and it's. I prefer this way myself. Why? Because the nail itself, it is a physiological barrier. You talk about microbiology, and the skin and nails, they are physiological barriers that prevent infection. So when we are removing it, what we are exposing the larger part of the body to infection. But sometimes, if it is hanging, yes, there is no way. We have to remove it. We have to remove it.
فكها يعني.
Surgical removal. It's not pulling it. So surgically there. So this is the normal angle that is between the bits of the nail and the skin. It is 160 degrees. See here, we call clubbing of finger, when it is more than that. So it is due to cardiovascular diseases. We call it clubbing of the finger.
Cardiovascular. This is for cardio.
Yes. So this is, we call it clubbing of finger. So palpation of the nail and seeing the change of the color. So consistency, nail are smooth also, and they are firm. Nail blade should be firmly attached also to the nail beds, so it is attached to the finger and to the nail beds. منبت يعني it has to be attached properly. The texture of the nail are hard and basically immobile. We cannot move it. So it is fixed. Assess capillary refill. While the assessing here, he is assessing the capillary refill. Each one of you can assess the capillary refill. Just you press on the nail and move your hand. Immediately you'll find that under the nail it will become back as a pink. The color it will become pink. When you look immediately after, you will see that it's white and it will change to pink. It means that normal refilling and normal circulation is there. So when we are looking at the head, we will look as to the size. We will look proportion to the size and to the size of the body also.
مستر ايش السبب في بعض الاظافر يطلع ماده بيضاء هنا؟ ايش بسبب نقص ايش؟ كالسيوم ولا الحديد؟
I will later on. I will tell you what's because there are different things. It might be normal sometimes if it is small batches. If it is in one finger, it might be normal. So it's not always a disease. Unless if it is. So the first thing we said that we will do inspection for the head itself. How it look like? Is it the symmetry between the two parts of the face also? The hair distribution. So all of those also we will consider it, and then we will try to feel the skin. We will see if there is any nodules, any rashes, any lymphatic lymph node enlargement is there. So head assessment, we have to inspect. We have different, according to the different person, we will have different look, but it has to be symmetrical. Here, the size and contour of the shape, center and proportional to the body, as we said, round symmetrical skull, and consistency with the movement that he can. So all the range of movement we have to do it for the neck and head. In assessment, we will take it in the assessment of the movement. So, but in palpation, also there are some area that we have to palpate in our in the face, which is the sinuses. So here we have the frontal sinuses. When we press over it, if there is inflammation or we feel pain is there, so we feel the sinus here, the maxillary sinus, paranasal sinus, frontal sinus. So when it is normal, there is, yes, we will feel the compression, but it is not painful.
يعني في جيوب أنفية؟
ها؟
يعني هذا يكون في جيوب أنفية؟
لما يكون في الجيوب ايوه you will feel the pain when we are pressing, so it will be very painful according to the inflamed one. So we have this one, we have the paranasal, we have the sinus. And you know that The bone of the head, there are some structure. We have the sagittal section, we have the frontal section, structure, the coronal sections. We have also the blood vessel, the temporal artery. So the temporal pulse, we have to feel it. So the shape of skull symmetry and smooth, as we said. The cranial bone, normal. And there is deformities in the head. If it is sometime, if macrocephaly is there, we will see the size of the head, that it's small size. In case of encephalitis in small babies, you find that the larger of the skull is large. If there is any lump, if there is any tenderness, when we touch it, it is painful. The patient will feel pain. So those are the things that the temporal artery is here, so we can feel the pulsation there. The temporal, also the temporomandibular joint. This is this joint, so we can put our hand here and make the patient move his jaw, open his mouth and close it. We will see the movement. If it is a smooth movement, no sound is there. No pain during movement. So this it is normal. So the temporal joint, smooth movement is there. No limitation, no tenderness when we touch it. No guarding or clicking or crepitation. No other sound or bobbing or tenderness. So if sound is there, it means either infection or fracture. Face assessment, the facial expression and facial assessment also depend upon the age, it depends upon many things. So here, if you look to the face here, what you observe, what's the difference?
في مستر في شلل ده.
Yes, so it is, in this case, you see that the mouth is going toward one side and here the eyelids is going down. So it means that the facial nerve in the right side is affected. So it might be cerebrovascular accident, CVA, or hemiplegia. It might be accompanied with weakness of the left side of hand and leg. Either it might be on the nerve, the facial nerve only, or it might be due to CVA, due to hemiplegia. Symmetry of the structure. Both sides, it should be, if you will take a line from the middle here, the section, both sides it will be equal. From the head, the top of the head, here, the forehead, and the eyes, and the nose, the mouth, so all are to be symmetrical, the same size. Involuntary movement sometimes might be there. You will find that muscle twitching it will be there. يركض العين بتحس أو أحيانا twitching. It depends upon the muscle that it has some problem. So here edema. It might be due to trauma. It might be due to infection. Palpation, as we said, those are the sinuses. This is the frontal sinus. So we'll press here to see if there is, normally should be, there is no pain, no tenderness. And here, which is the ethmoidal sinuses, or paranasal sinus. Here, this is the maxillary sinus. So when we are pressing no pain will be there. Yes, you will feel the discomfort because of the pressure, but with no pain. Neck assessment and inspection. طبعا neck assessment, we will see the position. We will see here the throat and the, what's this?
قصب الهم.
اللي غدة الغدة
Thyroid gland also.
الغدة الدرقية.
In males, it is more aberrant than females. Female, it is not like we call it Adam Abelsa. And also, it has to be, the movement of it has to be free. How we can test the movement of it?
حرك يمين يسار.
لا. تحرك يمين يسار ما بتتغيرش.
فوق تحت.
نطلب منه يبلع. لما يبلع بتحس انها تحركت، طلعت فوق وتحت.
يعني مستر اللي يتحرك اللي هي الجلاند.
مش الجلاند، هي الجلاند واللارynx. Both. So they are not fixed. يعني they might be fixed if there is cancer, if there is a swelling, it might be fixed. So the symmetry, position of the trachea, range of motion, also motion is smooth also and controlled. So it is controlled, it is voluntary controlled. Abnormalities and pulsation. There is a carotid artery here. We can feel the pulsation. Sometimes, if there is abnormality, you might see sometimes some throbbing is there. The veins also, usually it's not congested, not aberrant, but in case of some diseases, if you might find that the veins are congested. Jugular vein distension. Neck palpation, position of the, we see the position of the trachea, we can see from both sides. The position of the trachea should be at the middle and the move. Also, there is no nodules, is there, only feel the thyroid gland here and the trachea in the middle. There is smoothness, we will feel the muscles also. So strength of the cervical muscle, we can also sometimes do movement against the pressure. So to see the strength of the muscle. So we can put our hand on the patient head and told him to press there to see the strength of the muscle of the patient. Lymph node also, the lymph node will not be aberrant usually, but if in case of lymphatic disease, you might feel the lymph node. Mostly in case of tonsillitis, you will feel that the lymph node here is enlarged. There are many lymph nodes. There are lymph nodes also at salivary gland here under the tongue. So palpation, thyroid gland, posterior and anterior approach in palpation. Here, auscultation, she's ausculting the thyroid gland. If there is what we call parots, in case of enlarged thyroid gland, you might feel that, hear that sound. We finish, by the way. So I envision it is the second session. So did you have any inquiries? Any inquiries? La, because it is the end of the day, or you don't have, actually you don't have a question. Yeah. Yes. The end of the day. Sleeping. So in summary, when we are doing assessment of the skin, we look first. We will look for any change in the color, look any change on the texture. Then we palpate that we will see the changes. If there is any changes, we have to do palpation of it. Percussion, we can do percussion sometimes over the sinuses, but usually percussion it is done in the chest and the abdomen more than that to detect the organs. Auscultation, we might use it for the veins and artery. We might feel the pulse. So in general, those are